Hello, class. This is Tricia Fioravanti, and I have the privilege of working at Rochester Regional Health as a senior nurse care manager in the ambulatory care management department. The following is my analysis of technology at Rochester Regional Health. Rochester Regional Health System got its start in 1847 when the then Rochester City Hospital attained its charter. Over the course of time, the health system has gone through many changes and expansions to become the system we see today. Rochester Regional Health is an integrated health system encompassing 5 hospitals and 100 primary care and specialty clinic sites, behavioral health services, long-term and short-term nursing care facilities, and ACM labs that cover 13 counties in the greater Rochester and Finger Lakes regions. Rochester Regional Health System's goal is to build an all-inclusive healthcare delivery system that is able to provide for and manage patients' healthcare needs over time. Guyla Lockhart, nurse informaticist, shared a passion for her job. She indicated that her main role is to act as a liaison between clinicians and IT staff on the development of new technologies and systems that impact the quality and outcomes of patient care. Guyla explained that in her role, she provides the nursing presence and perspective at IT committee meetings to ensure that the needs of the nursing staff and users are adequately met. She utilizes her clinical and informatics expertise to provide insight, evaluate, and facilitate changes that benefit both patients and nurses alike. She also indicated that changes to technology like the EMR are prioritized based on safety, cost, compliance, evidence-based practice, and end-user impact. Liz Wild is the current senior manager for the privacy program at Rochester Regional Health and has a background in health information management. She also spoke very passionately about her role. Liz's responsibilities include the development, implementation, maintenance, and adherence to privacy policies, procedures, and systems that are meant to safeguard protected patient information. Liz impresses the importance that it is everyone's responsibility to remain attentive in regards to the use, safety, and security of health information. Technological systems assist Liz in identifying and investigating breaches with multiple systems running in the background to alert of concerning activity. Time-stamped medical records allow her to easily audit an employee's path through the medical record. Role-based user access, break the glass, and dual authentication are a few of the other safety features currently in place to protect and preserve health information. Through education of these 4 factors, Rochester Regional achieves safety and privacy in regards to protected health information. I was honored to be granted time to speak with Dr. Balazs Zenitz, our Chief Medical Information Officer, and Dr. David Krush, Vice President of IT Applications. They explained that their primary role is to specify, assess, acquire, implement, and maintain IT applications that keep the health system going. They have put into place a set of IT solutions to address problems, meet goals, and strategize for the future of Rochester Regional Health. Their responsibilities include providing education to hospital team members and assisting fellow providers in navigating the complexities of efficient documentation. They assist the health system to ensure compliance with evolving regulatory demands and healthcare delivery requirements. Their motto is IT for Us, or Information Technology for Usability and Safety. It is their belief that IT serves us, but also leads us. With the current demands in healthcare today, our survivability as a health system would be greatly lacking without health information technology. Rochester Regional Health provides an integrated network of technology across the health system. Technology includes human resource applications such as Workday, Kronos, and HealthStream Learning, administrative support through Microsoft Office applications, Polycom telephones, Lynx instant messaging, and video conferencing capabilities, point-of-care monitoring and patient support systems such as Dynamap, continuous BG monitoring, telehealth remote monitoring, barcode scanning, automated check-in kiosks, and safety devices including bed and chair alarms. Provider tools that assist with diagnosis, treatment, and interdisciplinary communication, such as SensiVest, Dragon Speaking Software, Haiku Secure Chat, and DaVinci Robot. The multitude of technology in use at Rochester Regional Health allows us to provide cutting-edge healthcare with the highest standards for quality and safety that impact our patients' lives. Rochester Regional Health utilizes Epic as their electronic health record vendor of choice. Epic was originally founded in 1979. Rochester Regional Health implemented Epic at Rochester General First and surrounding ambulatory practices beginning in 2011. Epic remained the enterprise solution for EMR functionality in 2014 with the creation of Rochester Regional Health that occurred as the result of the merger between Rochester General and Unity Hospitals. Implementation of Epic continued in 2017 when the application went live in 2 additional affiliated hospitals. As of 2019, Epic continues to be implemented across the health system into our long-term care facilities and newly acquired outpatient sites. Our last hospital site is slated to go live in early 2020. Epic provides a comprehensive portfolio of modules and services that are tailored to fit clinical needs, improve workflow efficiency, maximize revenue, and keep up to date with regulatory and compliance requirements. Epic also provides interoperability through their Care Everywhere feature, which allows users to access medical information from other institutions on shared patients who also utilize the Epic EMR platform. Advantages of Epic include the provision of one comprehensive record per patient accessible to all. Access is not based on location, but rather by your identified role. The ease of use is there is more than one way to document and navigate throughout the system. Pre-built templates and tools, and interoperability with other local hospital systems utilizing the same platform. Disadvantages to Epic are that it is seen as a barrier to human interaction. It is difficult to police. The volume of information contained within it can be overwhelming and difficult to navigate. The largest disadvantage is the threat to security that occurs through breaches of the system. Epic facilitates nursing care and positive patient outcomes through the use of standardized documentation, best practice advisory alerts, task-oriented reminders, and ease of communication. Documentation templates allow for consistency and the ability to run reports from standardized fields which provide information in relation to performance, care, and identifying future improvement initiatives. Best practice advisories ensure patient safety as they are grounded in evidence-based standards of care. Task reminders help to organize the delivery of timely nursing care. And communication can occur across the multidisciplinary team through instant secure messaging or an email directly attached to the patient's record. Patient outcomes and satisfaction are also enhanced through the patient portal and ME education interfaces that Epic provides. Providing high quality and self-care is reliant upon the EMR, which offers this seamless functionality. EMR incentive programs at Rochester Regional Health have proven to be beneficial. At Rochester Regional Health, we are HIMSS 7 certified, which is the highest level of integration for the EMR and indicates that utilization is at the highest standards. We have also been awarded the Epic Honor Roll Award at the Summa Cum Laude level. This is exclusive to the top 10% of Epic client organizations. The health system also participates in the Epic Gold Star program, which provides financial incentives for implementing EMR technology per Epic standards. These recognitions could not be possible without clinician satisfaction. In 2018, Rochester Regional Health measured that satisfaction using KLAS, a leading healthcare IT research firm that provides definitive ranking on vendors in the industry. The results of this survey indicated that 72% of physicians and 75% of nurses were either satisfied or highly satisfied with Epic. MyCare is the patient portal at our Rochester Regional Hospital. The earliest adopters of Patient Portal started offering use of this technology in the late 1990s and early 2000s. Rochester Regional Health implemented the MyCare Patient Portal in 2011 along with the Epic Go Live. Patient portals foster increased patient engagement and satisfaction in a patient's healthcare by making medical information more accessible through a secure website 24 hours a day at the patient's convenience. Using a secure username and password, clients can access health information such as recent doctor visits, discharge summaries, lab reports, and important healthcare reminders. Patients can also schedule appointments, request prescription refills, pay their bill, and communicate with their doctor about non-urgent medical needs. In 2018, the health system enhanced the information located within the patient portal with the addition of provider office notes through an application called Open Notes. Open Notes first began in 2010 as a study at 3 healthcare facilities to determine the effects of sharing notes between patients and providers. This move toward increased transparency allows patients to better recall the details of their office visits. Open Notes functionality enhances patient engagement and strengthens relationships by enabling patients to better understand their treatment goals and be an active participant in their healthcare. MyCare and Open Notes decrease the amount of time nursing spends on non-nursing tasks, imparting nurses with more time for what we do best, providing hands-on patient care. To achieve success, healthcare organizations must find ways to create ongoing relationships with people and empower them to make positive health decisions. Founded in 2012, Emmy is a leading healthcare provider of comprehensive and interactive patient engagement solutions supporting healthcare providers in delivering effective care. Emmy is a web-based application providing education through multimedia addressing multiple learning styles. Emmy functionality was introduced at Rochester Regional Health in 2018. Emmy seamlessly integrates into Epic workflows, easily enabling the selection and delivery of appropriate educational programs based on the individual patient needs. The Emmy library consists of several hundred topics ranging from how to manage chronic conditions or what to expect during a hospital stay. Emmy tracks a patient's engagement and progress through the material, indicating when a module has been started and completed. While Emmy provides a standardized solution to our patients' educational needs, it is not meant to replace the importance of the educational instruction that occurs directly between the patient and the nurse. Emmy augments an individual's learning and should be followed using teach-back methodology to confirm that appropriate learning and understanding has occurred. Medical groups and private practices are now using kiosk technology to streamline their front office procedures. Rochester Regional Health uses the Patient Passport Express kiosk system pictured on the screen. Development of the first healthcare kiosk began in 2005. This technology has only recently been introduced to limited primary care sites at Rochester Regional Health. With the kiosk system, patients are able to control their transaction in the office from check-in to payment. Kiosk systems provide interoperability with the EMR for the transfer of missing information captured at the time of registration. They also help reduce data entry errors and provide a notification when duplicate forms and medical data are found in the electronic health record, decreasing the need for follow-up, error, and phone calls, as well as added time to work tracking down information. Kiosk functionality improves patient safety and quality efforts through this mechanism. Checking kiosks also improve patient satisfaction by reducing waiting times by as much as 50 to 75%, thus allowing nursing to provide timely patient care. Remote patient monitoring is an extension of care provided through our home care agency, Rochester Regional Health Home Care. The origins of remote patient monitoring can be traced to 1948 when the transfer of an X-ray image first occurred over telephone wires. The field of remote patient monitoring shifted in the 1990s with the development of the Internet. Remote patient monitoring gives patients the ability to stay in the comfort of their homes and still receive medical care. Remote patient monitoring optimizes nursing care through the early detection and intervention towards changes in patient conditions that prevent complications and reduce hospital and emergency department utilization. Other benefits include increased patient engagement, improved quality of care, improved access to care, and increased patient assurance. Rochester Regional Health has an integrated platform of healthcare technology that is utilized to provide safe, effective, and quality patient care. It was impressive to learn about the vast amount of technology that is available across the healthcare system. I think my biggest takeaway from this experience will be Dr. Krush's statement that our survivability is dependent on technology. As more and more patients are learning that the technology they experience in so many of their daily actions and interactions can also be applied to their healthcare experiences, patients are seeking health systems that offer cutting-edge technology who are ahead of the curve when compared to their counterparts. Nursing will also need to continue to evolve along with these advances in technology. However, some of the basic things about nursing will remain unchanged. The core functions of our role, such as advocating for our patients, assessing their needs, determining how all of the pieces of their healthcare fit together, and most importantly, caring for our patients as human beings. As nurse leaders, our knowledge competency level, along with our ability to utilize technology and harness the data it encompasses to our benefit, will impact the way care is delivered and evaluated. It will also further nursing science. New developments in technology will continue to impact nursing and healthcare. We must stay the course in order to challenge ourselves to master new skills, improve the profession, and be competent with technology. Technology cannot replace, yet it can enhance our richly rewarding profession. Thank you for your time. I hope you enjoyed my presentation, and on the following slides you will find my references. Have a good evening.